I'll speak a little about the status of our evolving COVID-19 outbreak and what we can do to stay healthy this fall and winter, starting with the use of new updated COVID-19 booster vaccines, and also provide a brief update on monkeypox before taking your questions. So COVID epidemiology. Our Omicron BA4, BA5 wave has plateaued in late May, and that was sustained throughout most of the summer and has been decreasing gradually since mid-July. Over the last month, COVID-19 activity has decreased among all age groups, and we're currently classified in CDC's low community level. While our COVID transmission rate based on reported cases remains just above the 100 per 100,000 population over 7-day cutoff, which separates high transmission from substantial. So if we continue the current trend, we anticipate dropping from high into the substantial classification this week. It's important to remember, however, that reported cases reflect primarily PCR results, and they don't include at-home tests, and we know that not everyone with COVID gets tested. So it's really an undercount of true cases. Therefore, although we're trending down, there are still likely a few thousand new COVID-19 cases occurring in King County each day. Nonetheless, this likely represents a significant decrease from recent peaks. Our hospitalization rates have also decreased by almost 50% to approximately 3 per 100,000 over 7 days from our recent peak in mid-July. And this is a little bit different than what you see on today's dashboard, but the first day of the week, we always have a high hospitalization rate that gets corrected as those hospitalization cases get reviewed and the ones that are not hospitalized for COVID are eliminated. So I'm using the data from last Friday, which is most accurate at the moment. Yet over the past 7 days, 10 people were hospitalized each day, or one person every 2.5 hours. And this level of COVID-19 hospitalizations is similar to what we see during the peak of a moderately severe influenza season. And despite the decrease in hospitalization and cases, for the most of our summer, the deaths have remained relatively stable at 2 to 4 per day. However, recently, over the past 14 days, we've seen a trending down to 2 average deaths a day again due to COVID-19. This is a good trend again, but to put this number of deaths in perspective, if this recent level of 2 deaths per day were maintained, COVID-19 would be the 5th leading cause of death annually in King County, more than unintentional injuries or stroke or diabetes or influenza and pneumonia deaths. So it's still a substantial and unwelcome number of deaths. Now, we know that 82% of our hospitalizations in the past 30 days are among people over 50 years of age, and 91% of our deaths are among people over 60 years. 5% were among people under 20 years. Yet despite this risk, only 31% of 50 to 64-year-olds and 57% of adults 65 and older are up to date with COVID-19 vaccine and booster recommendations. Excuse me. So we need to do better getting our high-risk adults vaccinated and boosted. If you know someone who's 50 or older who is eligible and not yet boosted, remind them that it can keep them out of the hospital or save their life. So in summary, COVID-19 activity is decreasing, although we continue to experience a substantial number of cases, hospitalizations, and deaths. The problem of long COVID represents a significant but underappreciated population health burden for our community and our nation. It represents a significant challenge for our workforce locally and nationally, and it is estimated to impact 5 to 40% of people with COVID-19. What this means for us in King County is that there are likely tens of thousands to hundreds of thousands of long COVID cases in King County alone. So again, to try and summarize here, the COVID-19 pandemic may be evolving with fewer large surges and lower but substantial numbers of hospitalizations and deaths still. The burden of hospitalizations and deaths currently are falling more on the unvaccinated, on older adults, and on those with underlying high-risk medical conditions, while long COVID impacts a wider age range. And although no one wants to hear it, I don't like saying it, many don't want to accept it, it's clear that COVID-19 is not disappearing. It is changing. It appears less severe in important ways, but it's persistent, it's insidious, and it remains somewhat unpredictable. So we need to continue to focus on effective strategies that we can use to decrease our risk. With high uptake of vaccinations and updated boosters, plus immunity from prior infections, and in the absence of any major new variant that evades past immunity from vaccines and prior infections, the severity and impact of future surges could be limited. But we need to be prepared for the possibility of increasing COVID-19 activity as we enter fall and winter, and understand the long-term importance of sustained, layered strategies to prevent COVID-19, a disease that is not going to disappear. Now, our current levels of COVID-19 in combination with the return of a typical flu and RSV season, the respiratory virus season that we experience every fall and winter, will lead to severe stress on our healthcare system, with consequences for anyone needing to access healthcare for any reason. And so we really all have an interest in trying to minimize the contribution of COVID-19 to the previously existing stressors that we all experience every winter due to other viral respiratory diseases. The single most important step we can take to protect ourselves and our community is to get vaccinated. And if you are not vaccinated, get vaccinated. And if you are not boosted, if you haven't gotten a booster yet, you're eligible, get an updated booster. So again, the key thing, most important step we can take, get vaccinated if you're not vaccinated, and get an updated booster if you're eligible. So let me share now a little information from last week about the updated boosters. Why do we need updated boosters? Vaccines are the foundation for individual and community protection from COVID-19. Our boosters have been updated because since the original COVID-19 vaccines were authorized in 2020, the SARS-CoV-2 virus that causes COVID-19 has evolved. It's evolved new variants that can dodge some of the immunity we get from both past infections as well as our vaccination. The updated boosters are designed to improve protection against serious infections from SARS-CoV-2 viruses that are circulating today. They target both the original virus strain and the most common currently circulating variants, the Omicron BA.4/5 lineage. For this reason, they're referred to as updated bivalent vaccines. Bivalent meaning working against both the original strain and the current strains. Having updated booster vaccines authorized and available now gives us an opportunity to prevent many infections, hospitalizations, and deaths, both now as COVID-19 continues to spread locally, and to provide a higher level of protection during this fall and winter when transmission may increase. The primary vaccination series is essential for protection. Although most adults 35 and older in King County have received their primary series, more than 1 in 5 people under 35 years of age are not yet vaccinated. And although most adults 35 years and older have received a booster, more than half of those 35 years and older have not. But we know that the risk for severe COVID-19 is highest in older adults, people with any one of a number of common underlying health conditions, and those with weakened immune systems. Yet even among older adults at high risk for severe COVID-19, many have not received all recommended booster doses. And we continue to see disparities with both lower primary series and especially lower booster coverage rates among our Black and Hispanic community members and members of South and Southeast King County. Now, we know our vaccines are working well to prevent hospitalizations and deaths, both in King County and nationally, every day. In King County, in the past 30 days, people who are not fully vaccinated were 7 times more likely to be hospitalized and 10 times more likely to die than those who are boosted. So even if you've had a booster in the past, all recommended booster doses are important for maximal protection. For example, CDC reported in June 2022 that people 50 years of age and older who had both booster doses had 3 times lower risk of dying from COVID-19 than people who only had 1 booster dose. Excuse me. So let me talk briefly now about the bivalent booster, the updated boosters. These updated vaccines are now recommended to improve the duration and strength of protection against today's COVID-19 variants. There's also reason to believe that they will provide broader protection against future strains that may evolve, but that is not yet known with certainty. The new booster recommendations have been simplified. Everyone 12 years of age and older is eligible for an updated booster if at least 2 months have passed since completing their primary series or since receiving their last booster dose. And again, getting all recommended booster doses is especially important for people who are at increased risk for severe COVID, hospitalization, and death, including adults 50 and older, and those with weakened immune systems, those who are pregnant, and those with one or more of many common underlying health conditions, such as diabetes, heart or lung disease, kidney disease, overweight and obesity, cancer, certain disabilities, and more. And you can find those risk factors at the CDC's website for COVID. You just look up COVID-19 risk. You can Google that and get right to the long list of risk factors. Vaccination can also lower the risk for long COVID, which can lead to serious long-term health problems that prevent people from working and doing other activities that are important to them. So now let me speak a little about accessing the booster locally. It's important to know that sites may vary in when they're ready to offer updated boosters, but we know local healthcare systems and pharmacies will start receiving the boosters this week. We know local pharmacies throughout King County are receiving about 30,000 doses this week, and you can check on availability for your local pharmacy before you go to be sure they've got the vaccine in stock, and if they don't, they can maybe tell you when they will have it. We expect it won't be long. Across King County, we're anticipating approximately 92,000 doses that should be arriving this week and next week. We expect that our Auburn vaccination site at the Outlet Collection Mall will be able to offer the vaccine, the updated booster vaccine around September 9th, but that will depend on the specific arrival time of vaccine shipments from the federal government. That site at the Auburn Outlet Collection Mall will take drop-in, walk-in appointments for the updated booster dose. Our Eastgate Public Health Center is taking appointments for updated booster vaccinations starting September 12th. And we know that other healthcare providers have also ordered the updated booster vaccine, including Kaiser Permanente, UW Medicine, HealthPoint, CMAR, Snoqualmie Valley Hospital, ICHS, and others. And within Public Health Cell King County, our mobile vaccination teams are making plans to provide older adults with updated booster shots at senior centers and senior housing. There are about a dozen events scheduled at senior centers, and the team's also working with Seattle Housing Authority and King County Housing Authority to facilitate access to boosters. There will be community vaccination events ongoing also to provide additional options, and you can check our kingcounty.gov/vaccine webpage to learn more about the options for various sites throughout the county. And now I'll just transition to share a brief update on monkeypox. As of this morning, there have been 382 cases reported in King County. Nearly all of these cases are among men who reported sexual or close intimate contact with other men. And this may include people who identify as non-binary, genderqueer, or transgender. Most cases are between 18 and 49 years of age, and there was one case confirmed in an infant as of late August. Our team recently updated our website with additional information on case trends, demographics, and geography, and that is available to you at kingcounty.gov/monkeypox/data. Similar to other jurisdictions around the country, the rate of monkeypox cases is on the decline in King County. We've seen a decrease from a peak of 64 cases reported during the week of, or I should say 64 cases diagnosed during the week of July 31st to 19 cases the week of August 28th. And this decline may be due to a combination of factors, including behavior change and vaccination that's happening in high-risk communities. But even though these cases are on the decline, we don't know if it will be sustained, and it's important to continue efforts to help reduce transmission. We've recently updated monkeypox vaccine eligibility criteria, which can be found on our monkeypox vaccination website. And we are continuing to plan and facilitate vaccine access points to reach those at high risk, which includes access to vaccine for people who are becoming eligible for their second dose. And we strongly encourage anyone who received the first dose of monkeypox vaccine to come and get the second dose on day 28 or after to get the full, most durable protection you can get from the vaccine. One dose is not optimal. Both doses are required for the full protection the vaccine can offer. We also have another upcoming monkeypox vaccination event for people who meet eligibility criteria. That will be this coming Saturday, September 10th at Seattle Central, and that will provide both first and second doses. That clinic will be held between 10 a.m. and 6 p.m. So in summary, it's very important for those gay and bisexual and other men who have sex with men who are at increased risk to understand that it continues to be important to take steps to protect themselves through both vaccination and limiting the number of sexual and intimate contacts. We know the virus is still circulating in our community, and it is the extent of the outbreak is a combination of both people's behaviors and their immunity and susceptibility. So we need to be very cognizant that this disease has not disappeared. It's still around, and risk still exists, and it's important to do whatever you can to decrease your risk of acquiring this disease. With that, I'm happy to take any questions that you may have about topics of today's briefing.
Wonderful. Thank you very much, Dr. Duchin. And in the chat, you're welcome to use the raise your hand function, and then please share the name of your outlet, and we'll be happy to take your questions. So I see first a question from Kate Walters. You can go ahead with your question.
Hi, thanks, Dr. Duchin. Appreciate you doing the update. I have a couple of questions, if you would indulge me, around the updated booster. With the limited supply that will be in the county initially, are you asking for, a particular population to be prioritized? Is there anything that you want folks who are not at high risk to sort of know as the initial rollout happens? And then also just wanting to know what your thoughts are on the fact that the other the monovalent shots, as far as I'm aware, are now no longer authorized as boosters. So as we have a limited supply to begin with, folks are seeking out a booster, but they can't get the bivalent one. I guess just what are your thoughts around that potential complication?
Yeah, thank you, Kate. Good questions. We are not asking for any particular prioritization because we do anticipate that there will be a robust supply of booster doses rolling in over the next few weeks. But we do want people to understand that those at highest risk should come forward for their booster doses soon. So that basically is, adults who are 50 years of age and older, but in particular, risk goes up with age. So the highest risk would be the oldest adults and risk decreasing coming down. But, 50, 60, 75, 80, if you haven't received a booster dose in the last 2 months, or you've had a primary series in the last 2 months, or your last dose, at least any dose was at least 2 months ago, you're now eligible and you're at highest risk. And I think what we would like to see are the people who are at highest risk coming forward early. Now, there are some issues around timing. If you've been recently infected, for example, with COVID-19, it's not necessarily a good idea to come forward soon for a booster dose. I think, it's much more reasonable to wait several months, probably at least 3 months, because we know that the vaccination too soon after either a prior vaccination or a naturally occurring infection does not result in the optimal benefits from that vaccine. So you're not getting, all the protection that you could get from that vaccine if you get it too soon after your last dose or too soon after a naturally occurring infection. So if someone's been diagnosed with COVID-19, waiting 3 months is probably the best strategy. And for people who are lower risk, who have been recently vaccinated, although we ask to wait at least 2 months, depending on your unique circumstances, your medical history, and your risk of acquiring COVID-19, you can discuss the optimal timing with your healthcare provider. People who are at high risk of exposure, people who are at high risk of illness, generally would benefit from coming forward at the 2-month mark or sooner. People who've been recently infected and people who are at lower risk of exposure or lower risk of severe outcomes, it's reasonable to wait a little bit longer. But it's not a good idea to try and time your booster dose appointment for when the next surge comes, because that's unpredictable. No one can, really predict with certainty when they will be exposed to COVID. As I've said, even now with the recent decline, there are thousands of new cases occurring each day. There are many thousands of people who have infectious COVID-19 in our community right now. And even if you've been vaccinated or previously infected, it's a good idea to minimize your risk of acquiring further infections, because we do know that although severe outcomes are less likely, such as hospitalization and death with reinfection, some adverse consequences do increase. Cardiac, pulmonary, blood clots, and other complications of long COVID are possible after reinfection. So with COVID-19, the rule of thumb is, get infected as few times as possible, even if you have been infected previously or vaccinated previously. You do want to take steps to decrease your risk of getting reinfected or infected the first time. Yeah, now that doesn't mean you have to turn your life upside down, but you should take some simple precautions, such as being vaccinated with recommended doses and taking precautions to prevent yourself from being exposed, such as wearing a mask in indoor public spaces and testing after being exposed and so on. Does that answer your question?
It does, thank you.
Thank you. And then, Kate, you were also asking about the previous booster dose and if you had any thoughts around that, the monovalent booster.
Yeah, the fact that that's no longer authorized. It sounds like you're expecting that we will have a good supply of the bivalent booster. So it sounds like maybe that's not quite as much of an issue as I was anticipating it might be.
I think that is the consensus among, the immunization world, that that the supply is going to be good, that we won't have overwhelming a rush for doses. We certainly hope that people at highest risk come forward, but that this new booster, updated booster, does include some of the protection that the older booster offered, the original strain, plus importantly protection, or I should say, is formulated to cover the newer circulating variants, the BA.5, the Omicron lineage. And it's thought that that combination is going to provide a better response and a more durable response, and potentially be more effective against a wider range of variants that might evolve. That will only be known with certainty after we vaccinate enough people and see how well protected they are, how long, but there's no reason to think that it will be any less protective against the older strains, and the preliminary data that's available suggests it should be more protective.
And as we're waiting for other folks to add their questions in, I had a question that we're receiving about flu. So what do we know about the upcoming flu season and related to the new COVID vaccines? Any concerns about getting a flu shot at the same time as the new booster, for example?
Well, what we know about flu season is we won't know about flu season until we experience flu season. But often Southern Hemisphere gives us some clues about what we might expect. And they had a relatively robust flu season, big return, after the relative quiet seasons that we've had the last few years with little influenza circulating. It's quite possible that the reintroduction of influenza will be more severe because lots of people haven't seen flu for a couple of years, and therefore their immune systems just aren't primed and ready for it. So vaccination is going to be really important because we do have, this potential warning from Australia, New Zealand, Southern Hemisphere countries that had a pretty active flu season. Now that you can get your flu vaccination at the same time that you get the COVID-19 vaccine. There have been lots of co-administration studies done, and there are no specific safety concerns. If you're an older adult and you're getting the adjuvanted flu vaccine, it's recommended to get those vaccines in different limbs, but otherwise they can be administered at the same time. However, if someone doesn't want that for any reason, and you have good access, you can get your flu vaccine 2 weeks after your updated COVID vaccination, for example. But there's no recommended or required, time interval between one vaccine and the next. They can be administered at the same time or, a few days later if someone prefers that, but that's not necessary.
Excellent. And related to COVID precautions, you talked about where we are as far as transmission locally. I know lots of parents and families are sending kids back to school last week, this coming week, and are starting to think again about what their family should be doing right now. We've talked about the pillars and the layers of protections, but just as far as where we are now and what you anticipate in the coming month or so, what should families be doing as they start to think about masking, talking with their schools, testing? What's the latest guidance today on that?
Well, the recommendations really haven't changed much over the last few months. We have been recommending, and emphasizing the importance of both being up to date on vaccination, meaning all booster doses, but also taking very seriously the health benefits that we get from wearing high quality, well-fitting masks like N95 or KN95 or KF94 respirators when in indoor crowded spaces, and the critical importance of improving indoor air quality, not only in schools, but in all our public buildings and businesses and other places where people gather, and improving that indoor air quality through the use of improved ventilation strategies, through filtration, which can be achieved through HEPA filters or something like the Corsi-Rosenthal boxes, and or the use of UV germicidal technology in settings where that makes sense. So, these are simple steps people can take to reduce their risk, masking in crowded venues, making sure air quality is good, taking steps to improve air quality in our public spaces, and then testing, after exposure to COVID-19 and when symptoms develop, not attending school or other group activities when you're sick or have symptoms that might be due to COVID-19, but testing yourself and understanding that it can take several days for a test to turn positive, particularly if you've been previously vaccinated. So not assuming that the first negative means there's no infection, but testing through day 5 is the best way to know if your symptoms are due to COVID-19. And we do know that this disease spreads very readily from people both before symptoms develop and during the early days of symptoms. So taking precautions to prevent spreading to others before you know for certain whether you're infected is a good idea as well.
Excellent. Thank you so much. I have a few monkeypox questions that are coming in from the community, but before we shift gears, a couple more questions on the new bivalent booster. When do we expect greater supply of the bivalent booster? I know you mentioned we expect around 92,000 doses to be coming in this week and next week. Do you have more information about when we might see a next doses coming in?
Not handy. I don't have that information handy, but we can check with our immunizations team and see if we can get a longer range forecast for you.
Excellent. Great. And it looks like another question about whether people need to bring proof of previous doses to get the bivalent boosters. I would imagine it depends on the provider, but we can follow up as well unless you had more to say on that, Dr. Duchin.
I think most providers will request some sort of documentation. If you're in their system, obviously, that's easy. You can go to your Washington State Immunization Registry and download your vaccination history there. If you haven't been vaccinated in Washington State and you have a vaccination card, that should do the trick as well. But it's important to know that these bivalent boosters are boosters. They're not meant for the primary series. So it's important for healthcare providers to understand that they're administering this vaccine in the right sequence. So again, anyone who's 12 and older who has completed a primary series or has had their last booster more than 2 months ago is now eligible. But it is important to have documentation of that prior vaccination history when you appear to get your booster, your new updated booster dose.
Great. Thank you. And switching over to monkeypox for a moment, a couple of questions coming in. One of the questions has to do with our eligibility criteria and wondering if we anticipate that as the supply of vaccination for monkeypox increases, whether our eligibility criteria will continue to expand. And if so, what are your thoughts there on where it might expand, including potentially general adult population or not?
Okay, so whether the eligibility criteria, or let me say it another way. The eligibility criteria really are based on who's at risk, right? We don't recommend vaccines for people who are not at significant risk of a disease. And right now, our eligibility criteria are based on the current epidemiology of who's getting monkeypox and the communities in which it's spreading. Another concern is whether we offer vaccine to specific additional groups or not, really is a decision that we have to make in collaboration and consultation with our colleagues, our federal colleagues at the CDC, because there are other areas of the country that have much larger outbreaks than we do who may need vaccine doses, more vaccine doses than they're currently allocated. So, before the one jurisdiction would recommend vaccination widely to an expanded group that may be at lower risk, it would be important to make sure that throughout the country, those people who are at highest risk have access to vaccination. So a couple of considerations there are, is the supply adequate based on, not only our local need, but needs elsewhere, or do we need to reserve some of our vaccine for other communities that don't have enough and have higher risk? And then secondly, do we have evidence that it would make sense to offer vaccine to others? And that really will depend on how this outbreak evolves. If it continues to decrease, as I hope it will, I'm sure everyone else hopes it will, that would make the need to offer vaccinations to a broader population group not really make a lot of sense. But if we see something unanticipated and worrisome, such as people who are outside of the currently designated eligibility groups becoming infected, that would make us think hard about the need for expanding the vaccination eligibility. So at this point, there are no plans to further expand eligibility because the outbreak isn't showing us that that makes sense. But if that does make sense based on who's becoming infected, we will certainly consider that.
Thank you. A question here from the community saying that we at Public Health have suggested that people who may be at higher risk for infection from monkeypox could make some changes to their sexual behavior, including limiting the number of partners, sexual partners, and other steps to reduce risk. For those people who've chosen to do this, the question is, how long should they keep this up, particularly if numbers are starting to go down? And any guidance around whether the reduction in cases means that people may begin to go back to some of their previous behaviors, particularly if they're vaccinated.
Well, good question. The way an epidemic plays out, it really is due to a combination of factors. One is people's behaviors, how they interact with one another, and the environments and circumstances in which they interact with one another. One is the particular susceptibility of individuals, whether they have immunity due to prior infection or a vaccination. And one is just the virus itself, or the pathogen itself, and how well it spreads in different populations in different circumstances. And we know that the most effective way to interrupt transmission is through behavior change, through not putting yourself in a situation where you're exposed to the virus. And right now, we've asked people to protect themselves by limiting the number of sexual and intimate contacts. The people who are at risk through in the gay, bisexual, and other men who have sex with men, people in the community of that at-risk group who have a large number of sexual contacts, anonymous sexual contacts, et cetera, can very much decrease their risk by limiting that number of sexual contacts and intimate contacts. We know at the moment that the virus is still circulating in our community, so we would very much encourage people to continue to exercise precautions such as limiting the number of contacts, high-risk contacts, sexual contacts, intimate contacts, until we see this disease and are confident that the disease is no longer circulating at levels that we can detect. So, and of course, getting vaccinated, adds a further layer of protection. So I can't tell you how long this guidance will be in place, but it will be in place as long as we believe the virus is circulating in our community. And it's possible that even if we see the circulation waning or even disappearing to the extent that we can detect it here locally, it may continue to circulate in other communities, both in the US and around the world. So to some extent, the guidance may be situation specific or location specific, geography specific. But at this point for King County, it makes a lot of sense for people who are at high risk to continue to modify their behaviors, to limit sexual contacts, to perhaps practice potting, which is maintaining a smaller group of sexual contacts in order to prevent exposure to monkeypox. It's still out there, and we don't want people to become infected, potentially serious disease, very uncomfortable disease. So still need these guidelines locally.
And I know when we were first receiving very, very scarce, limited number of vaccine doses, we were prioritizing first doses as much as we can. We now know that people are becoming eligible for their second dose potentially if it's been at least 28 days. Are you encouraging folks who now have had those numbers of days between their first dose to go out and access our resources and get their second dose?
Yeah, we're accepting both first and second dose appointments at the clinics that we are sponsoring, and we encourage people who are at risk, who have not received the first dose, to continue to come forward, and also those who have already received the first dose, if it's been 28 days or longer, to come and get your second dose.
Excellent. And then before I turn it over to you for any final questions, just one last question coming in about boosters. We know that the booster doses switching gears here from monkeypox back to Omicron will be available for folks ages 12 and older. For that younger group, the 12 to 18, are you recommending that people go to check in with their healthcare provider, their pediatricians first, to be able to get that vaccine, to check out our sites, or any advice specifically for that age group?
Well, if you're interested, if you've got a child who is 12 and older, who is eligible for an updated booster dose because they completed their primary series or had a booster, their Pfizer booster 2 months or more ago, it is the best idea is obviously check in with well, maybe it's not, I shouldn't say obviously, but the best idea is to check in with the child's healthcare provider to see if they've got vaccine available. You can also access vaccine through one of our clinics when vaccine is available at those clinics, which are going to be posted on our webpage. But if you have your own pediatrician, I think it's a great idea to talk with your pediatrician about timing. That's always a good thing to do. And that goes for older folks as well, particularly if you're wondering about, when you should get your booster, if there are considerations related to your personal health history, or, you've had COVID recently. The healthcare provider is the best first stop for understanding your personal situation as best as possible. We have information, also that can help people make their own decisions about timing of vaccination on our website. There's a lot of good information on the CDC website. But again, the bottom line is, you're eligible 2 months or more after your last dose of the primary series, or your last booster dose if you're 12 years of age and older. And there are some circumstances in which people may want to wait a little bit longer, particularly if they've been recently infected, or they're just wondering about their own particular history and the risks of COVID-19. So again, talking with the healthcare provider in those circumstances can be very helpful.
Great, and we'll put in the chat again the website so that folks can get information about where to go for vaccine. It's kingcounty.gov/COVID/vaccine, and we'll put that information on. And then as far as monkeypox, we're also updating that page, kingcounty.gov/monkeypox/vaccine, and that has information about eligibility, as well as options to go for vaccine. So with those resources, I wanted to turn it back over to Dr. Duchin for any final words before we wrap up.
Thanks, Sharon. I will just reiterate a few key points. First of all, the updated booster vaccines are an important step in improving our ability to limit the ongoing impact of COVID-19 on our lives, on our community, and on our economy. And I want to close by reminding everyone that getting vaccinated and boosted is the single most important thing we can do to decrease our risk. But vaccination alone is not sufficient to optimally protect our community from COVID-19. Public Health Seattle and King County continue to recommend wearing high-quality respirators and masks like N95, KN95, and KF94 in indoor public spaces when transmission is high. We continue to recommend improving air quality in our public spaces, our businesses, and our schools through ventilation, filtration, and/or UV technologies where that technology is appropriate. We continue to recommend testing after exposure to COVID-19 and when symptoms develop, isolating when infected, and wearing a high-quality mask after isolation in accordance with CDC guidance, and knowing if you're eligible for Paxlovid treatment and how to get that treatment quickly if you become infected, and understanding if you're eligible for Evusheld treatment if you're immunocompromised. We really encourage everyone who's at high risk and eligible for these treatments or preventive treatments to take advantage of them. They save lives, they keep people out of the hospital, and these layered strategies together remain important at this stage of the pandemic. So again, thank you all for taking the time to be with us today, and I look forward to chatting with you again in the future.